Starting. All right. So today we are going to be discussing about glomerulonephritis. Okay. Glomerulonephritis. So what is glomerulonephritis? Is any disease which is affecting the glomerulus. Okay. And causes can be both primary or secondary causes for glomerulonephritis. So primary is when there is without any underlying cause, like can be like idiopathic. While secondary is due to diseases like diabetes mellitus, SLE, and malaria. Okay, so those are the primary causes and secondary causes. And how can a patient with all these present? That's the next question. How do I delete this? Okay. Yeah. So next question is, how can a person with glomerulonephritis present? So they can have various presentations. They can present with proteinuria, and then they can present with even hematuria, and then they can present with a nephrotic type of syndrome, and then they can present with a nephritic, and then they can present with rapidly changing renal failure or acute renal failure. As well as they can even present with chronic renal failure in some instances. So glomerulonephritis, these are how the patient can present. They can present with proteinuria, hematuria. They can present with nephrotic type of picture or nephritic picture. Sometimes they can have combined of both. Okay. So before we go into this glomerulonephritis, let's just go into how a glomerulus looks like. Okay, so you guys know that there is the afferent arteriole and the efferent arteriole, and then there is, and then they form the glomerulus here, and then there is the Bowman's capsule. And what they mainly filter is usually like water and electrolytes, like sodium, and some of these electrolytes get reabsorbed later on in the distal convoluted tubule, proximal convoluted tubule, and the loop of Henle. So that is a brief outline of what the functions of the glomerulus is. And then we go into the how the glomerulus basement membrane looks like. So the glomerular basement membrane, it has, or also known as the glomerular filtration barrier. I will put it as GFR, the glomerular filtration barrier. Okay, so it has three main layers. Okay, so first it has like an endothelial layer, like this, which I was drawing before, endothelial layer. And then it has a basement membrane. Okay, it has a basement membrane, is like this. Okay, followed by podocytes or epithelial layer, which contains podocytes. Okay, so podocytes have like foot-like processes like this. Okay, so in the endothelium, the endothelium, the glomerular basement membrane, the epithelium are all negatively charged. Okay, but the most negatively charged are in these food processors, which are in the podocytes. These are podocytes. So the most negative charge is in the food processes of the podocytes. Okay, and so what happens is these gaps are very small, and they only allow small substance to pass through. Okay, so these also a gap, this area here. Okay, these also gap, these are known as, this initial gap layer in the endothelium is known as fenestrations, and then here these small gaps in the podocytes are known as filtration slips, and these foot-like processes contain a negative charge. Okay, so these is the basic three layers in a glomerular filtration barrier. It has an endothelial layer, followed by glomerular basement membrane, followed by podocytes. So podocytes has steels between them. Okay, and these steels, also known as food processes, are negatively charged, which allows molecules to pass through. And this glomerular basement membrane has like mesangial cells, and it's mainly composed of collagen. Okay, so that is about the glomerular basement membrane. So the factors that affect filtration in a molecule is the size of the molecule as well as the charge of the molecule. So negatively charged molecules are unable to pass through the glomerular filtration barrier. Why? Because negative repels negative, and large molecules are unable to pass through the slit. So only small molecules like water and electrolytes such as sodium can enter. Okay, so now I'll just give a small example of a nephrotic syndrome. Okay, so nephrotic syndrome, they affect the glomeruli. Okay, so I'm going to start off with minimal change disease, which is a type of nephrotic syndrome. Okay, minimal change. Okay, so in minimal change, so you know the glomerulus, the function is it filters small molecules to produce urine, and usually it allows small molecules like sodium and water to enter the tubules. But in nephrotic, these glomerulus can get damaged and becomes more permeable. Okay, so the glomerulus gets damaged and becomes more permeable, and then protein can leak out. Okay, so protein can leak out. So there can be protein urea. So protein leaks out and there can be protein in the urine. So when protein gets lost from the body, there would be less protein in the blood. So they can get hypoalbuminemia. And then when they get hyperalbuminemia and proteinuria, they can also get edema. Why? Albumin is needed to maintain the oncotic pressure. So they get edema. And then since proteins are lost, there is loss of lipoprotein. So LDL, HDL is lost. And these important in transporting cholesterol. So as a result, cholesterol is not sent to the liver. Okay, because this LDL and HDL are also lost in the urine, so cholesterol is not sent to the liver. So there would be hyperlipidemia as well. Okay, so that is the main characteristic. These are the four main characteristics of a patient who has nephrotic syndrome. So they have proteinuria, hyperalbuminemia, edema, and hyperlipidemia. Okay, and the proteinuria is about 3.5 grams per 24 hours. Okay, so these are the characteristic features in a patient with nephrotic syndrome. So nephrotic syndrome, there are four characteristic features. Now I'll go a bit into the glomerulus, how these glomeruli can get damaged. So there are small slits, and then there is the glomerular basement membrane, and then there is the podocytes. So I told the most negative charges in the food processors of the podocytes. Okay, so most negative charges in the food processors of the podocytes. She just message. So small immune reactions can damage these food processors. Okay, so small immune reactions can damage these food processors like this. As a result, the negative charge will be lost. Okay, the negative charge will be lost. So molecules such as albumin are usually negatively charged. So albumin is negatively charged. So as a result, since the negative charge is lost in these food processes, albumin can leak out, and that's why there is mainly selective proteinuria in nephrotic syndrome. Okay, selective proteinuria, because mainly the negative charge is lost. Okay, so this is what I just mentioned is mostly seen in minimal change disease, and this is very hard to see under a light microscope. Okay, so under light microscope, very hard to see. So in minimal change disease, the light microscope would not show anything. Okay, so light microscope would be normal. An electron microscope will show damaged food processes in the photocytes. What is Ashish saying?
Kavit,
Yeah.
what are the reasons for the damaging of the podocytes?
I'll come into that.
Okay.
Okay, so you can, yeah, there can be food processes can be damaged, and depending on the type, there can be fusion of the food processes. Yep. So now I'll go a bit into the types of nephrotic syndrome. And other things about nephrotic syndrome is other proteins can also be lost in addition to the albumin. So such as antithrombin 3. Antithrombin 3, which is the body's natural anticoagulant. So when antithrombin is lost, there would be hypercoagulability. Okay, so that is also a feature of nephrotic syndrome. And as a result, also there will be hyperlipidemia, which I mentioned because of lipoprotein loss. So when it comes to nephrotic syndrome, the diseases you have to know are minimal change, focal segmental glomerular sclerosis, and membranous nephropathy or membrane nephropathy. So when it comes to minimal change, it is usually after a recent infection of the, let's say a throat infection or something. So this is T cell mediated. So I'm going to go in minimal change. So because of the recent example viral infection, there are a lot of T cells in the body, and these T cells can cross react and damage the podocytes. Okay, so T cells can damage the podocytes, and then these podocytes can get damaged, and as a result you will get proteinuria. However, these only for a brief period in time, so the changes are minimal. Hence, that's why it's called minimal change glomerulonephritis. Then we go into focal segmental glomerular sclerosis. Focal glomerular sclerosis. Okay, so this is usually idiopathic, but then there can be patients who are, example, drug addicts such as heroin addicts and patients with HIV. They are more likely to get focal glomerular sclerosis, and these also the podocytes get damaged due to immune complexes. Okay, immune complexes due to these HIV as well as heroin abusers, and these also can get damage the podocytes, as well as these patients there is lipid can also get deposited in these podocytes, and this can also damage the podocytes, and there can be uh, scarring and fibrosis. So then the scarring and fibrosis, also the negative charge is lost. Okay, and so why is called focus?